Hello, everyone. Thank you so much for joining another monthly webinar organized by Nishta Research Council. I am Mohammed Zishan. I'm a child and adolescent psychiatrist and chair for Nishta Research Council. And today we are lucky to have a really great speaker, Dr. Mohammed Hasib, who will talk on simulation of systematic review. Dr. Hasib is a hospitalist at University of Pittsburgh Medical Center. He's a graduate research fellow, Brigham and Women Hospital, and treasurer, Harvard Medical School Master Student Council 2021-2022. He's a postgraduate student at Harvard Medical School, and we are really lucky to and thankful for him to spare his time on the weekend and share his thoughts. So Dr. Hasib will have the presentation, the presentation part will be get recorded. And after that, the question answer session after the presentation will not be recorded so that you can have any question concern that you would like to ask directly from him. So thank you. Without any delay, I would like to invite Dr. Hasib to share his presentation. Thank you.
Okay, thank you, Dr. Zishan. Okay, Assalamu alaikum, good morning, good evening, everyone. I think my introduction has been already been detailed, so I don't have to repeat that part. So it's our presentation is simulation of systematic review. So main objectives of our talk, I think the main thing which I wanted to do was in one talk, it's difficult to summarize everything all together for you to get understanding of systematic review and meta-analysis. But I think it's a good start that we can familiarize you with how the whole process is done so that the individual components or skills necessary, we can try to see if we can arrange some other seminars or webinars on that. But getting a wholesome picture, I think, will give you understanding as well as make you at ease to conduct systematic reviews and meta-analysis. So another objective, which is very core to me, I think Dr. Zishan, Nishta Research Council, Dr. Arbaz, is that we want to advance culture of academic activity at Nishta. I think there will be other medical students here as well. As part of the alumni, we are very much interested that our students and other graduates can get involved in academic activity at our institution. And we think we can actually make it like sort of a symbol that we are doing that much of activity. That's the hope down the road. So we are here on part of Nishta Alumni of North America, Nishta Research Council. I would actually encourage, before starting the presentation, to all Nishta students who are already there to actually get engaged with Nishta alumni as well as Nishta Research Council. I think getting involved is going to be beneficial for both, as well as it will actually accelerate our work of advancing the culture of academic activity in our institute. I think student memberships are always free, and you should actually join and collaborate with all of us. So this analogy I want to start here with is the significance of academics. I think just to understand a bit, I believe maybe one or two might understand what it might be, but it's difficult to understand what it is, right? Like, so whenever you think about any new recommendation, any new article that's coming in, it's difficult for you to understand out of the books, right? So that's the same thing when you graduate or within medical school as well. Anything outside of the book, you have to develop those skills to interpret research papers, new recommendations that are coming in, and how you can use them. So that's what basically this shows. And just to give you an idea that you heard this term many times, that there is evidence-based medicine. Evidence-based medicine has been getting practiced in Western world for some time now, right? But I think that the era that is coming in is that you will have a lot of information coming in every single day, every single month, and interpreting that information in real time and using that information to build your understanding, as well as use that information for your patients, is very important in this era, right? So I think if pandemic has taught us something is that everything was so evolving, right? Like every single day you were hearing one medication is coming in, some treatment is effective, something is not. And if you see, God forbid, if one of our family members was in this sort of situation, we were always thinking, what is the current available evidence out there we can use for them? And it's the same thing, our patients are same for us as well. So that's why we want to interpret scientific evidence. That's what our goal is. When you think about academics, you want to interpret that scientific evidence. And why you want to interpret that? I mean, you want to interpret that for your patient care, right? And on the cherry on top can be that once you are able to interpret it, use it for your patient care, you can also develop the same amount of scientific evidence while you are actually practicing as well. And so it's very important to know how to communicate that scientific evidence out there as well. So that's why it's, I think the whole paradigm of getting involved with academics is going up. But that's basically the main motto behind that, is that it's very clear cut thing that that's what medicine is heading towards, and you have to be ready for that. Before going into the systematic review part, I think my audience, which when I prepared the slides, were most of students from medical school, especially Nishtar. I think so. Basically, just to get their attention to some important points here so that they understand what I'm going to be talking about later. The first thing you should be learning before we jump into systematic review is, what is a research question? First thing, you will see that this mnemonic here, which is sometimes called PICO, sometimes called PICOT, whatever you want to call it. But that's the basic thing. For any article, any study, there should be a clear-cut research question. And that's to basically define it, like in a form of a PICO. What is PICO? So basically, P is population. Just to take you with sort of an example with it, for example, the population is maybe heart failure patients. I stands for intervention. It can be anything. It can be like, for example, we can take the example of maybe Lasix or furosemide for heart failure patients. C is the control here. Control meaning you will be comparing it to something, right? Like you can compare it from the patient's situation before giving the medication or after. You can compare it to some other patients who are not taking the medication. It can be anything, right? Like, so whatever the situation might be at that point. And O is very important here, which is the outcome. I think outcome, I'm going to try to slightly explain it in the next slide. And the outcome is basically what you are going to be measuring. Like, you know that you have a heart failure patient, your intervention is like giving Lasix. What are you trying to see in them, right? So outcome, for example, we can think of exercise tolerance. Like you give a medication, you want to see in heart failure patients what's their exercise tolerance will be, whether it will increase or decrease, you don't know, but you want to test that or see that for your patients. And T stands here for time period. Like you cannot see that research intervention for indefinite time period, right? So you will be seeing that for certain time period. It can be 2 months, 1 month, few weeks, year, 2 year. So this slide is very important in sense that I think even if you read any article, whether it's a systematic review or it is a randomized control trial, anything, just try to read the abstract, which is just one paragraph, and devise out of that what is the PICO here, like what is the population, intervention, control, outcome, time period they are trying to present here. And once you do that, the good thing is that then when you go into the article, you will have much better understanding of things, because we all have been through this process where we previously did not know anything. Like, for example, the slide which I showed you with a lot of equations there, but things starts to make sense with time. And these are few things which I just wanted to give you so that you have understanding how to read the articles first and then go from there. Next thing, as I said, I wanted to talk briefly, just one slide about the outcome. So outcome, we already talked about an example of exercise tolerance. I think in the simulation part, we are going to talk about one of the examples where it will be weight loss. And you can see here, I have written myocardial infarction. You can see myocardial infarction in your research question in the outcome as well. Like, for example, you are trying to see giving patients aspirin, whether it increases their risk of developing myocardial infarction, whether it decreases their risk of myocardial infarction. Similarly, in another research question, you can give aspirin, you can see whether their bleeding risk now increases or decreases. So you can see that the whole part of the research question can be similar just by changing outcome, whether it's MI, whether it's bleeding risk, you can completely change the whole research question. So that's why outcome is very important. And when you are trying to understand outcome, just to give you sort of a layman, I would say, terminologies a little bit. So you can see here that I mentioned here. So outcome should have to be measured one way or the other, right? Like you cannot just say that you saw few things or very vague statements. You have to be clear about what outcome basically is gonna be, right? So statistical measurement tools are there to quantify the outcome. That's the simple way to put it. So you will see in papers, they will mention different things. It can be mean, it can be mean difference, it can be risk difference, risk ratio, odds ratio, hazard ratio. Don't get afraid of all these different terms, but just try to understand that that's just the quantification of the outcome you are trying to assess. And interchangeably, you will see that people will use the word effect estimate. So it's almost the same thing because you have some intervention, you are trying to see its effect and you are quantifying it, right? So basically it's an estimate one way or the other. So interchangeably, it can be called as effect estimate. So basically two main things before we go into that. One thing was the research question, the PICO format we talked about. And within that, we talked about is the outcome, which is important. There is quantification of that. You can interchangeably called as effect estimate. So going into systematic review, I just wanted to show this picture here to give you an analogy that what's the significance of systematic review? You can think about this crowded space. It's actually in New York, but you can see that there is a lot of information that's coming your way, going out. And the information is out there like in the form of different randomized trials or some other observational studies. How you gather them all together into one space to create a systematic review. That's what basically the significance of systematic review is, if you can understand from this point. And just to make it a little more scientific, I would say, I have shown you here a slide that actually it shows significance of systematic review, I think, excellently. You can see here from the top that there is a randomized control trial. There can be some cohort studies, case control studies. It's very difficult to conduct all of these studies on the top. Not that difficult to conduct systematic reviews, I would say, but doing a perfect systematic review takes a little time. And so that's why you have to be systematic. That's why it's called systematic reviews. So all of that goes down into systematic review. That systematic review with expert opinions, with prior evidence, with overview of previous systematic reviews, all of those actually go down to part of the guidelines and recommendations, which you will not actually see that much in your books, right? Like once you graduate out, you will see a lot of information, a lot of guidelines. And these are the guidelines and recommendations that tells you as a clinician that patient is coming with MI, you are going to give aspirin, statin, beta blocker, that's going to change their outcome this way or that way. These are the guidelines and recommendations that develop. So there is systematic review has a central value here, okay? I want to clarify here, people, I think wrongly sometimes say just meta-analysis. Systematic review is a bigger heading. Systematic reviews, as I have mentioned here, it summarizes the evidence from multiple studies. Some of those studies can be, as we mentioned, that there are outcomes there. Some of those studies' outcomes can be summarized quantitatively into sort of a called meta-analysis. So that quantification measures, if you combine them together, if you are able to do that statistically, we will talk about it briefly. It's not that difficult, so don't get afraid of that point. But just trying to give you an idea that if you are able to quantitatively combine them all together, that's the meta-analysis part of the systematic review, which is the bigger heading. And the second part is, for example, if you're not able to combine few studies all together, you will be presenting them in the form of descriptive statistics. And as the name indicates, it's that simple, that it's describing those numbers, whatever the statistical numbers you had from the outcome, which I told you before. You're just going to describe that part because you're not able to meta-analyze that, right? So the systematic review, bigger heading, it will have both. It will have the meta-analysis part, it will have some other descriptive part, okay? So let's go into systematic review. I'm just going to show this slide. Don't dive that much deep into it, but just giving you headlines of what different steps are, and then we will go over them to give you an idea. So the first thing in any systematic review is develop a review question. Second thing is that you want to make that review question crisp and clear so that it's evident what you are trying to do. It's defining a review question. Then what you do is that you develop a search strategy, because as I mentioned, it's a systematic review. You have to develop a systematic search strategy so that you are not missing important information out there that you are not including in your review. Then you register. At this point, you are ready to register your review that you are doing it so that other people know about it, so that they are not doing the same thing which you are, because you are already working on it. Then you conduct the systematic review and select the studies. I will show you how. Then you, at the end of conducting systematic review, you will left with few studies, like maybe 2, 3, or 5, or 7, whatever the topic is. And then you extract data from it. Once you extract data from those studies, you are able to, in a position to analyze that data, you are able to write that paper up. Okay, so I think in few of the groups, I did send this article. One of my mentors is actually in this article, but I just wanted to show that we will actually try to sort of simulate a smaller study, sort of like that. So they are trying to assess is effect of aspiration therapy on obesity related comorbidities. So that was done in 2020, Jalapeno. This was a group exercise which I wanted to show you how we sort of not simulated, but we actually working on a group project as part of one of our courses. And we came up with this question. We started doing it. When we were actually writing it up, we were not writing it up for publication. We were just writing it up for our assignment part. But we did find out that someone did recently published it, which was a good thing to just compare what we were doing, what they have done already. So these were my group people in that assignment. So as I mentioned, different steps of the systematic review. First part is develop a review question. You will see few of these terms I mentioned here that they are difficult, but once you start looking into the literature, you will find that these are not that much theoretical. They are very practical things. Review question can come from your content expert, like for example, your senior mentor, your senior. It can come from your own clinical experience, like you are finding something difficult while you are managing your patients. You find that thing, whether its answer is available in literature. You try to see that there are different, let me see what happened. Okay, sorry about that. So you develop a review question. You So basically you see in your clinical experience that there are different people have different effect estimates out there in the literature, and you don't know what to believe. You can definitely do a systematic review to combine all the studies together and see what basically the answer is for yourself, and show it to the world that that's what you found. So background literature search is extremely important. So how did we do that? Like in the form of a group, what did we do? So we had 4 people, me, 3 other. My interest was mostly in GI obesity. The other person's interest was in pediatrics. One other person's was more interested in cardiology. The fourth one was in endocrinology. So we spent a week. We thought about what questions we can be, because I was part of the group who does endobariatric sort of research and work. So my thought process or what studies I was reading was more about endobariatrics. So I came up with my question, my colleagues came up with their question. We sat together, we did like background literature search of each of our topic, which we were thinking. We did sort of discussion, we presented our questions to each other, that that's what I want to do. So I think at this point you should know that systematic review, if you're doing a systematic review, which is like a very central role, which I have shown you already, that it has a central role in the academic part as well. When you are developing recommendations, it's very important that you have a team of people. One single person will not be able to complete it. And I think that's why there are like guidelines how to do a systematic review. I will actually show you what basically the things are. But basically you will need in each of the step 2 reviewers to do different things, so that if there is conflict, you can talk to the third reviewer just to make sure that you are doing the right thing. You're not just messing up anything. And as I think it's said, mostly I have heard it here at Harvard most of the times, that garbage in, garbage out. That means is that if you are not doing a good job, you're just sending garbage into something, you're not gonna be expecting a much better outcome out of that. You will still see garbage out, right? So it's very important to do sort of a good work. I think there can be systematic reviews that are done out there, which are, I would say, not that great. Those papers might not be that much useful when it comes to uh, clinical evidence, but they are much good examples to show in sort of master's program or PhD programs to tell the students that that's not how you want to do the work. So basically, you just don't want to be those people whose work will be presented at such institutes where they will be saying that don't do such type of work or something like that. So I think it's imperative that we do a good work. Um, and that's what I think you should take out of this webinar as well. So in our simulation, getting back to that, what we did after discussion and presentation was that we came up with a little broad idea. They accepted my idea. They said, okay, let's do endobariatric therapy for weight loss. So it's a broad idea at this point. You can see you don't know what you are trying to assess, but you are just saying, okay, weight loss is something. There is endobariatric therapy, but there are many endobariatric therapies. What you want to do, whether you want to systematically analyze all of them or some of them, we don't know at this point. So that was our week 1. We just came up with the idea and then left. Okay. Next part of the systematic review is define a review question. I think that's what the part which we already talked about, which is where the PICO comes in, right? So again, you will need to read more about whatever the general idea you got, you read more about it. You maybe talk to other people who are more experienced in the field. Like, so basically you need content knowledge, clinical experience. You do literature review, which I talked about, that it's very important. And then the PICO, that's what we talked about before, right? So that's what it comes down to. Like, it comes down to defining your review question. I think this is the very critical point of the systematic review. If you are crystal clear about your different aspects of PICO at this point, you will have a very good systematic review, at least to the point of your research question. Whatever you are trying to assess at this point, your systematic review will be addressing it clearly. If you will be vague at this point, you will not be able to do a good job with the systematic review. Okay. So what did we do? We did the same thing. We looked at the literature. We saw that there were many observational studies on the topic. Because it's like an intervention, it's difficult to do randomized controlled trials on such type of thing. We did, so there were different procedures. We got to know more about endobariatric procedures, like there were like almost 3 or 4 procedures. And we thought about how the studies who are already published have assessed it, like how much time duration they have assessed it. Some might have assessed it at 1 month, some might have assessed it at 3 months, some might have assessed it at 9 months, some might have assessed it at 1 year. So there were different time periods out there. So that's what basically your baseline literature review should all include this PICO thing, so that you can clearly define it at this point. So what did we do? What we did was that we tried to explain our PICO point here. We said that, okay, our population is patients with obesity. Our intervention is we picked up one of the endobariatric procedure, not all of them, because it will make it more confusing a bit. You need like a little bigger team, more expertise to do such type of broad question. But to make it simple, we just wanted to assess one of the intervention, which was aspiration therapy. We looked at the controls. There was no controls. The control was the patients themselves. Like we were trying to assess their outcomes at baseline compared to their outcomes after certain time period. Okay, so that there was no control here. What was the outcome, which is very important, as I mentioned before? So it was weight loss. But as I told you before, that there are different quantitative ways that can be sometimes clinically relevant, and different other things takes into account. Most of the studies which we looked at were assessing excess weight loss percentage or total body weight loss percentage. So that's what we thought. Okay, so these are the 2 outcomes we are trying to be assessing. We will look at all the studies. We will try to extract data only on excess weight loss percentage, what they have mentioned, and the total body weight percentage. And then the last part, like, as I mentioned, there were different time intervals there, 3 months, 6 months, 9 months. We thought that it might be best we just do it for 1 year. That's it. Like, it's our choice at this point. You can define your review question as you like. You will bear the consequences at the end, but I think that's what your choice is at this point. You can do it. Okay. The next part is search strategy. So this search strategy, as I mentioned, should be systematic. It's a systematic review, right? So it should be a systematic search strategy. There are different sites out there, resources out there from which you actually drive all these studies. PubMed, you have heard about. Embase is more of a European database, but basically Embase is one. Cochrane is there. Web of Science is there. These days, if you are going to do a good work, you should actually include all of these 4. There are others as well, but just to keep it simple, just remember these 3, 4 that you have to do at least these. So doing a search strategy is a skill in itself, and I think we can talk about it at another time. There are other resources available online, but I don't believe that much into online resources. I think if someone tells you in a better way what are the pitfalls in something, that is much helpful than generalizing it to see it out there that it's available. So hopefully at another day we will talk about how to develop a search strategy. Each of this systematic review will have different skills. I think if you are, because as I mentioned, systematic review is a teamwork. For example, someone is expert in search strategy, someone is expert in analyzing something, someone is an expert in something else. I think it's helpful that team will be able to do all the work and will be able to complete the systematic review. So that's a good thing. Okay. So, and another thing I just wanted to let you know here, that people do ask their librarians. If there are people who are residents right now here, most of the librarians are very well skilled in doing search strategy for you. They do it like at Harvard as well. We have Countware Library where librarians have like a online portal where you submit your request and they actually do a search strategy for you. Personally speaking, I did it for one of my projects, but the second project, because I tried to learn this on my own and from the some lectures which we had at our courses. So it's practice. If you practice more, for the second review, I just did it for myself. So basically, you can also learn it. It's not that much difficult, but it will just need the practice as for anything. So what did we do in our simulation? So we did the same thing. We were 4 people. We tried to develop our own search strategy from whatever lecture we learned about. The same person who gave us that lecture, we consulted that person just to see what we are doing wrong. Maybe we had that at that time, I think maybe 500 studies. He tried to correct that a little bit and we came up with maybe 300 or something studies. So, I mean, as far as you are grabbing all the studies out there that are relevant to your research question, you are good. You don't, but still precising it helps to some extent. So this is the search strategy part. That's what we did. This is just an example of a search strategy. As I said, it's a skill. You can learn it in a day or so. If someone teaches you, you practice it 2-3 times, you will be able to draw that by yourself. This is not for the one which we are doing a simulation for. This is something else which I was working on. But basically, you can see here that you just drive 2 or 3 questions from the general. I would say I take my word back. So basically, what you want to do is from the research question, you will drive 2 or 3 topics, right? Like it can be weight loss, it can be other things. And then you basically combine them all together and just see how many studies are out there in PubMed. And once you get it in one database, you can actually just copy paste that to the other databases and see how many studies you get in them. So this is the point where it comes when you register your review. It's important these days to register your review because once you will try to publish that, people will ask about it, that whether you register your review ahead of time. This is some recommendations that have been generated over the years because you just don't want people to do a very not that great work in systematic reviews and at the end of their review just change their research question and just come up with few studies and just meta-analyze them or describe them and complete a systematic review. So it will be, as I said, garbage in, garbage out. That might not be a good thing. So that's why these days we do register our review at this point. So basically, whatever the knowledge I have told you to this point, you assimilate that knowledge, and however you want to analyze it later, you just combine those things together and just write it up. It's a very intuitive way to write on a registry. I will show you that part. General concepts about available studies. So basically, when you are reviewing your studies, you will have some idea. Okay, so these are the general concepts. Like, for example, as I mentioned, if you are doing observational studies data or some other data, you don't know. But basically, once you review them, you will have better idea. Okay, general concepts about these studies are. So basic components in that registry are title, author, research question, search strategy, what will be your inclusion, exclusion. It's extremely intuitive. I think if you go over that website once, it's called Prospero, where people register their systematic reviews, you will see that it gives you a heading and it tells you what things needed to be in it and gives you an examples there as well. So once you do it by yourself, I think another thing is that still, I think it's again a skill. Once you do it, someone can tell you once that, okay, that's how I did it. At some point, we can do that. So you can go over Prospero and you can do the same thing. What did we do? We did the same steps. We tried to assess what are the different steps, like who will be the authors, their numeric number, like which, and their order, the title, the research question, search strategy, inclusion, exclusion criteria, whatever, all of these things you can think of. And what we did was that we skipped this part. The reason behind that was that we were doing it as a part of the exercise and we were not going to be registering it or publishing it. So that's why we skipped that part. But this is the main part of doing a systematic review in general. Okay. So this is just the, I can show you here that you can see that this is basically the one of the Prospero site picture I have shown here. So it's not that difficult to go to Prospero and work on it. Let me actually see how I can show you that. So if you can see here, I don't know how to move that down. So this is the interface of Prospero, right? Like you can go to this Prospero website. You can just make your account. It's very easy to make an account. You can search other systematic reviews. You can go to this tab and just do register your review now. You can even search for previous reviews if someone is already working on one of your projects, so that you don't work on the exactly same research question. You can see, you can just search them up. You can just see who is doing what. Like, for example, people have registered their systematic reviews. Once you are ready to register your systematic reviews, you can review reviews by the registries by others and take a look at how you should be writing your systematic review. It's very intuitive on this website. So it's not going to be that much of a hard skill, I think. Much easier than doing the search strategy thing. Okay. So that's the Prospero part of things. Let's go back into the slides. Okay. So the next thing is conduct a systematic review to select studies. That's the main part, and I will actually show you how it is that easy to do, but it's systematic to do. So you should not be afraid of doing that. That you have like 1,000 studies or 2,000 studies or 3,000 studies. What you do is, as I mentioned, it's a systematic approach. You can use reference managers. There are different names, like you can use EndNote or something else. Covidence is a very good resource. I think there is RevMan as well. If you want to write down Cochrane, you can just write down Cochrane, maybe Google it. Cochrane have a lot of information about different softwares available to conduct systematic reviews. I have mentioned like just one maybe, but basically there are many. Covidence I found myself very easy to use. I will actually briefly show you that part as well. So what you do in this systematic approach is, first you look at just the title and abstracts, just one title and the abstract, because the concept here is that you are driving in maybe 500 studies, and all of these 500 studies are not addressing your research question. You might actually get maybe 300 to 400 studies that are completely irrelevant to your research question. Actually, I will show you that part, how basically that can be. And there might be 40-30 studies that basically matches their title and abstracts to your research question. So those are the studies who will you open them up, retrieve them, and do full text review. Like you will read the whole text of those studies only. And once you read the full text, you will have better idea, okay, whether these studies match your inclusion exclusion criteria or which is derived from your research question, which I told you earlier, or not. And then you finalize those studies who matches that. And then that's basically conducting a systematic review to select studies. And in any of the, I think, systematic review papers, I think one of them I sent you as well, but in general, you just open one systematic review meta-analysis paper. The first thing you are going to see in their figure 1 is Prisma flowchart. And I'm going to show you actually what is that basically, but that's the Prisma flowchart that shows how you conducted this part of the review. Again, as I mentioned, there should be two reviewers who should be doing it separately. And if they have conflicts, like for example, one say that this study should be included, others say that, oh, I don't think this study should be included, they should actually discuss this part between them, why one thinks maybe other person might have overseen some part of that. But if there is still conflict left, you can talk to the senior person, like you can talk to the third reviewer, what do you think? And if that person says, okay, I vote in this favor or that favor, you can just include or exclude that on that basis. So that's basically the process is. And it's the exact process when you read a systematic review paper, they have mentioned in the methodology part. So it's not that difficult to, because that's the same thing which you are doing, and that's the same thing you will be writing in your methods part. So what did we do? What we did was that we used Covidence. It was available. Covidence is very good resource, I think. We did title and abstract and full text review and final studies, and we came up with a Prisma flowchart. This is the Prisma flowchart. I have taken an abstract from same Jarapinio study. You can see here that they showed from the start that there were some, they identified this many studies, like 225. And after that, they removed some duplicates and they came up with 24 studies for full text review. And they removed few of those studies based on this part. And at the end, they had 5 studies. This is called Prisma flowchart. What did we came up when we at the end did it? You can see that we had sort of 550 studies. We came up after removing some studies, 216. There were 72 studies left. We did full text review of all of those 72 studies and thought that 69 does not match our criteria, and 3 studies do. So that's how we did it. It was not that difficult. And let me show you actually how the Covidence thing looks like. This was the Covidence that we actually did ourselves for the same simulation. And you can see here, you can see that there are like close to 4 headings here. First one is import references. Second one is title and abstract screening. Third one is full text review. Fourth one is extraction. And that's all the steps which I mentioned there, right? So what you usually do is whatever your search strategy is, it's very easy to import all those references here just to include them into the software. After you have included them, software from all the different sources, as I mentioned, there were 4 sources. The software itself will try to remove duplicates. You can see that it removed like maybe 332 total duplicates removed. It will send automatically all the ones which are single studies to title and abstract screening. Title and abstract screening is very easy to do here because the title and abstract will auto-populate here. You can just look at the title and abstract and say yes or no. So you will just do yes or no here in this part. It's quite intuitive to understand. So I'm just telling you that because once you do it, you will feel that it's much easier to do this part of the work. The third thing is full text review. So whatever 2 people will say, so for example, I am doing, Dr. Zishan is doing on his end, whatever studies we think should be included to full text review, if we both have said yes on our end separately, it will go on to this full text review part. And this full text review part will have maybe, here you can see 72 studies, right? So you will review the full text of these 72 studies. Similarly, 2 people will review them and see which studies match our research question or not. If 2 people have said yes to one thing, it will go on to the next part, which is the final part where you have selected your last 3 studies. So here we selected our last 3 studies, and this is the part where you extract data. That was our, I think the next slide as well. So let's go back to the slides. So this was the part where we do the extraction of the data, right? So what you do is, for example, you have selected these studies, 3, 5, whatever it is. You will, based on your research question, define whatever the definition of your inclusion exclusion criteria is. You will basically think about what do you want to extract. So the question is very relevant. What do you want to extract at this point? Like if you are just beginning your work, I can feel you because I was there in your place not that while ago. So you take a look at the previous reviews, you look at what your review question is, because sometimes your review question should be matching what data you will be extracting from there, right? Like, so for example, it's weight loss outcomes. So you will be extracting data about weight loss, BMI, things like that. You will not be extracting data about bleeding or something like that. So it's very, once you start doing it, you can actually review the previous systematic reviews done to get better understanding of what data points might be important to extract. Initially, what you can do is, my suggestion will be that you try to extract as many data points as possible. You make like a Excel sheet and then go from there. And once you have extracted a lot of information, then at the end you can decide, reviewing the previous questions, what data points you want to present in your study and are relevant to your review question. Again, the same thing, two reviewers should do that so that there is no mistakes. At this point, there can be mistakes. So you should try to avoid that, because two people will be doing it. It will be easier to recheck. Like, for example, someone has assessed weight loss to be 13 and maybe by mistake has written 15. And when you collaborate and you talk about it and there will be discrepancy, you can just talk about it and that problem can be resolved at that point. So what did we do? We did the same thing. We, based on our review question, decided which tables we want. We looked at the prior reviews. We tried to do is, that's the basic model. Usually what people do, they study patient study characteristics and outcomes of interest. Usually those are the main tables. And again, two reviewers did it. So this is the abstract I have taken from the Gerapino et al. Study. You can see because they had 5 studies, they have mentioned here 5 studies, characteristics of the studies. And this is what we did. We had 3 studies, so we actually showed it similarly, almost similarly. So the next part, that's the part where people feel that it's hard. I just want to tell you before going into this part that doing analysis part of systematic review is the easiest of the analysis in all of the studies you will see. Like, for instance, I was doing a cohort study, and that formulas to conduct that whole study takes like almost maybe 140 or 200 lines. But to conduct an analysis of a systematic review, it will just take 2 or 3 lines. So just you can compare how much easy the analysis part is. I think the more time you need to spend is not about how you will conduct the analysis, because you will be able to do that. That's not that hard. It's more about what you are going to interpret from it. I think that will take a little time, but you will get there. I think that's the things you will learn with time. Okay. So in any of the papers, if you try to read any of the systematic review and meta-analysis, I hope once you go out of this webinar, you will try to read at least this paper, which I sent you. You can just read that paper and you will see what things you see in the analysis part. You will, in the results part, I would say, you will see a thing called forest plot. I will show you that. You will see a term called heterogeneity. I can show you briefly about that. The heterogeneity is just differences between the studies, because everyone has done studies differently. So there is something called statistically to assess how much different the studies were. And there is thing called funnel plots. You will heard a lot in the systematic reviews. That's just assessing publication bias or things like that. We don't have to go into those details, but right now I just want to introduce them to you so that I can also show you how it's done, and it's that easy. I think the main thing will be how you interpret the results, that you will learn with time. And as I have mentioned before, that systematic reviews can have 2 components. It can have meta-analysis part, it can have descriptive part, and then whatever studies you feel like are not able to meta-analyze into one effect estimate we talked about earlier, you can just describe them. Like, you will say that this was the study done by this, and this was the result in it. And whatever the findings are, you can just narrate it in your paper. There are different softwares that can be used. There is Stata, there is R you will hear about, there is others as well. Some are free, some are with some money. But I think there are free available softwares there which can easily do statistics of systematic review. So that part is not hard. I would tell you that. I will actually show you how to do that. It's very quick, just sort of a simulation so that you get a little familiar and feel a little ease with doing that. Based on review questions. So basically what we did was we did the same thing based on the review question and the prior reviews. We tried to see what things we need to meta-analyze. There were, as you remember, we had 3 studies. 2 studies that could be meta-analyzed. The one study which we could not meta-analyze, I think there was some difference between the studies, so we could not meta-analyze that study. That we just described it. As I have mentioned you before, that there is meta-analysis part, there is descriptive part in the systematic review. And we used Stata. Let me show you the outcomes, and then we'll go over the simulation just to tell you how it was done, okay? So you can see this is from Gerapino et al. Study. So this is called forest plot. So you will see it in all of the systematic reviews. Like it's sort of a constant thing for everything. This is like a meta-analyzing different results into getting one effect estimate. That's why I introduced you to the term effect estimate before, like getting one number. Like you might have 3 numbers from different studies. You are trying to meta-analyze them into one number. What is the number which you think is the sort of, in layman terms, I would say averaging out of things. It's not exactly average, but just to make you understand it a little better, it's sort of averaging out and getting one estimate. So that's what they did. And that's what we did. Like we actually have more colorful graphs here. But in any case, so that's what we did. We were able to meta-analyze our 2 studies. One study, as I mentioned, we just presented it. This is called a funnel plot. Again, you will see that in the studies, and I will actually show you that how easy it is to graph all these things. Again, the main thing is the interpretation part. I think we'll come to that. Let me just go down here if I am able to show you. So this is interface of Stata. You don't have to use Stata. There are much easier ways to do it. Let me just clear my screen here. I'm just gonna import sort of a data which I created for this presentation. It is the exact data which we sort of did for that exercise. Let me actually show you what this data has. This data has just an Excel sheet, and this Excel sheet only includes these things. It's not that complicated. It's just as it is. It is showing 2 studies done by Dr. Thompson, Sullivan. Dr. Thompson is my mentor. So basically it's showing here N1, you can name anything, but it's basically showing how many patients. Mean is showing how much mean weight loss in each of these studies were. In Thompson study, in Sullivan study, and this is just showing standard deviation. This is also usually given in these studies itself, okay? So these 3 things are already mentioned in the papers which you will be including. So this is sort of mentioned at, I think at baseline, and after the procedure was done, you can see how many patients were there, which data we had. This is again the mean, and this is the standard deviation. So that's all the information it is here, and see what we can actually get out of it. And just showing you how easy the commands are. Actually, let me do it this way. So I think there are very intuitive things, few things. You don't have to learn just data. There are other options as well. But you are just trying to tell the software. I think, can we mute? Okay, so So you are just telling the Stata that's the study you are trying to see. And you are just trying to tell Stata, these are my variables. This is for control. This is for treatment. Very straightforward here till this point. And you are just trying to tell the software that this is meta-analysis you are going to try to do. So you just enter it here and you just click this forest plot. As I said, this is the forest plot you will see in all of the studies. And you just click da-da. So basically you have the result. So you can see this is the same forest plot we got in the other studies, and it's showing us some effect estimate here, other studies, some results. This is I-scare, which I mentioned is sort of called heterogeneity assessment. So you don't have to go into those details at this point. Just try to understand that that's how it is done. And it is as easy as I showed you. uh, because as I mentioned, the hard part is the start part, how you systematically run things, how you have the team to do that systematic work. The end part, which we are usually afraid of, is not that hard. So that's how we did it. It's that simple. And the other thing you can do, there are other different things you can do here. But if you just do this publication bias thing, you just click this and you can get a funnel plot. So this is a funnel plot assessing some publication bias. Don't have to go into detail, but if you read any systematic review, you will see these things there. You will see these terms there. And I just wanted to show you how it's done in an easy way so that you get a little familiarity with the concepts. Okay, let's go back here, I believe. Okay, what's the next step? Now you have all those things which you have done. You have some results there. I have shown you different ways of getting the results out. What you're going to do now is just summarize everything, like write it up. Writing can be an art, but I think writing is not that hard part. A lot of people can read and can write as well. A few people might have difficulty, but I think this is not that difficult part. You can just summarize all those results. You can present them in different ways. Sometimes you can do it sort of in Excel sheet as well. There are different options to present results. That's not that much important, but I'm just saying that it's just you're trying to present your results as good as possible. You can interpret the results, you can just conclude those results in your manuscript. That's what you do. You in the introduction part, I have mentioned a few things what you do. I don't think we need to go over them that much, but you can see that there are three parts of actually four parts of any manuscript. Like any paper you see, there is an introduction part where you try to describe what you are trying to study, you rationalize your idea, you see you tell the audience what the gap in the literature is you are trying to address. These are different points. You can just, I think, uh, do it.
Silvio, we can't hear you. Sorry for the inconvenience, just give us a few minutes. There is some technical difficulties, so I think Dr. Hassi will just log in out and then he will log in again. Sorry for the inconvenience. So in the meantime, if you have any questions, please feel free to post in the chat. I know I just saw Dr. Sadiq Naveed, he has joined, so thank you for joining. Let me stop the recording here for a minute.
So
go ahead, Dr. Hassi, go ahead, please.
oh, I'm just trying to move this. Are you seeing this notification on my screen?
No, so the slide that I'm seeing is simulation of systematic review, summarize, present, interpret, and conclude, and now it's moving discussion.
Okay, so that's what as I was talking, sorry about the disruption in between. So, but what we will be doing is that we will be summarizing it. That's the last point. We will be summarizing it, present our findings, interpret them, and conclude them to whatever understanding we have about the topic. There are different parts of writing. You know that it's introduction, methods, results, and discussion part. And it's not that difficult to write them, but I think it's again practice. You will learn that with time, how to do that. What we did was the same thing. We divided our work, like one person is going to write the methods part, one will be writing the introduction part, and the discussion part, few people will write that. And then we did multiple revisions. We talked about, we met each other like maybe after every week, and we discussed what we have written, got criticism from the other people to see what things we can improve on those parts, and then revise them. And that's how the final manuscript will be ready. So I have already showed you in between Covidence, Prospero, and the analysis and the forest plots, which I wanted to. And thank you. I think we can stop recording here and move to more of questions and answers.